Hi, everyone. My name is Lena, and I am the program manager at the RYR-1 Foundation. Thank you for joining us tonight. I am excited to introduce Dr. Jeremy Arman, and he's here with us tonight to report on his findings on his survey, the educational experiences of children and adolescents with an RYR1-related disease. Jeremy, would you like to introduce yourself?
Yeah, absolutely, absolutely. Yeah. So my name is Dr. Jeremy Arman. I have been working with the RYR1 Foundation for a few years now. I've presented at the International Family Conference a few years ago about special education and how it relates to RYR1 related diseases. I'm a nationally certified school psychologist. I just recently graduated with my PhD in school psychology from Duquesne University in Pittsburgh. Part of my graduate training with my dissertation was this survey and this work that I did is trying to basically get a better understanding of what the education, the educational experiences look like for this population. There was a lot of like lack of resources and kind of what that looks like, and I think it's just like really important work. So yeah, I'm actually really excited. Part of the study was basically just getting descriptive statistics, so just frequency counts. So it's really simple data to kind of understand, and I really liked that because I wanted to be able to share it with the community. And it's very digestible kind of like language, and it's really important information. So yeah, I'm really excited to be able to share this with you all. So yeah, let's get right into it.
Okay, so Dr. Arman, what are the common classroom problems experienced by children with an RYR1 related disease?
Yeah, so this is probably one of the most simplest questions to answer from the survey. This is a table that is in my dissertation. As you can see, there's basically a bunch of common classroom problems that have been addressed in educational research previously. And if through the survey, we just basically surveyed a bunch of parents or caregivers of children or adolescents ages 3 to 18, and just basically said, just tell us, what does your child experience? So these aren't ranked by, most difficult to least difficult. This is just frequency of individuals. So you'll always see like a total population number usually at the top. And if there's not, I'll share that. So you can see out of 51 people that filled out this survey, 29 indicated that their child or adolescent experiences difficulty with handwriting. Handwriting and written expression were the two most prominent ones. I'll get back to that in a second, but the other thing I kind of wanted to note that this kind of data kind of shows is that there is a variety of difficulties across presentations. So that's just important to note that there's a lot of individual differences. RYR1 affects everyone very differently. There's a vast diversity of presentations, so the classroom difficulties kind of mirrors that, which is kind of important to note. At the very bottom, you can see the least common ones. This is another important thing to note, and this will come up later. Defiance or like being uncooperative, aggression, and hyperactivity, these externalizing kind of behaviors, is really not popular or common with this population. The handwriting and the written expression. Handwriting is kind of what we hypothesize to be the most difficult, or at least the most common classroom difficulty, because handwriting is one of those academic skills. It's that actually incorporates motor movement. And with weakness in those motor movements, we would expect difficulty with that. On top of that, handwriting is a fairly common difficulty amongst children and adolescents. One thing I really wanted to note just for considerations is going while your child is developing, if your child is one of these individuals that struggles with handwriting, there's a lot of research that supports that handwriting is pretty directly correlated to written expression development kind of going forward. So the handwriting is the physical production, and the written expression is more of the like expression of the writing. So like the content of the writing, the connections that are able to be made in that writing, and they are very correlated. So difficulties in handwriting can also lead to difficulties in written expression kind of down the road. So things to just keep note of if your child has it and they are developing. You see some handwriting difficulties. It can easily be addressed through special education, which are conversations that we're going to have. But just to note that that's kind of the primary difficulty that you're going to see. Yeah, we can go to the next question.
Okay, so how often do children with RYR1 related diseases receive special service in school, and under what IDEA categories does the child qualify?
Yeah, that's a really good question. So, the biggest thing, there's two parts of this question. To fully understand like the answer to it, you kind of have to know what IDEA is. So, IDEA is a federal law that came out in 2004. It stands for Individuals with Disabilities Education Act. It's basically just a federal law that ensures that students with disabilities are identified and receive services in school to support their educational success so that they can receive free and appropriate public education. So, as part of that, students who are identified as needing services in school, whether it's through special education or just informal services, there's two types of services. There's accommodations and then there's modifications. Accommodations are one of the lowest intensity of services. This is basically where the academic standard, does not change compared to like the general population, but aids and accommodations are provided to kind of level the playing field to support that child to meet those standards. It's pretty like low intensity. They're fairly common. You can usually get these through a Section 504 plan. The next one is modifications. So these are a little bit more intense service. This is basically where the actual academic standard changes. So where you modify that standard to meet the child where they're at to help them kind of like thrive in the educational environment. And this is usually done through an individual education program or an IEP. So those are the two types of services that you primarily see. So the first part of that question is, do students receive special services in school? The answer is yes, profoundly yes. So of the 40 individuals that we asked, you can see there was a big dip. The parts of the survey were basically for international populations in addition to the US. Because this looks at just special education in the US, it was only US participants. So there was a total of 40. 21 indicated that they had a Section 504 plan. These are just those accommodations, so just aiding their schooling. And 31 indicated that they had an IEP. So 12 indicated that they had both, which is very common. A lot of the time, when your child begins to struggle in certain things, you can add accommodations to see if that supports. If after a while the accommodations alone are not enough to support, then you can kind of adapt into an IEP, and that's a pretty typical kind of thing. So only 5 of the 40 have not received any services in school, whether it's a 504 plan or an IEP. So a vast majority did actually receive special services in school. The second part of that question is, what IDEA category do they get identified under? And this is really, it's kind of a nuance, and I don't think a lot of people know about it, but there's 13 disability categories in IDEA. And this is basically saying your child has to qualify for one of those disability categories to receive special education, to receive an IEP. And these are the 13. There's more than 13 here because specific learning disability is one, but it has like writing and reading and math. But you can see orthopedic impairment, other health impairment, and speech language impairment are the 3 most common IDEA disability categories for which individuals with an RYR1 related disease qualify for special education under. Orthopedic impairment is the most common one. It's also, I would argue, it's the most appropriate one. So orthopedic impairment pretty much refers to congenital myopathies, which RYR1 is. Basically, any sort of disease or disability that impacts motor function. So that's the most appropriate. Other health impairments, a little bit more broad. This is really just any sort of disability that impacts your ability to like access curriculum in the classroom. So this could range from anything from ADHD all the way to chronic fatigue or chronic pain, which RYR1 presentations would qualify under. Totally appropriate. And then speech language impairment's a little bit different. So this is referring specifically to production of speech difficulties or communication difficulties. This is usually going to be tiered with speech language pathology services being provided in school, but one common presentation with RYR1 is difficulties with the bulbar muscles, so the muscles in the mouth, face, and throat, which can result in those production difficulties. So it makes perfect sense that if that's the presentation that your child has, this would be an appropriate category to identify under. One more important thing to note about this data is that in special education world, you can qualify for special education under multiple categories. So you could have orthopedic impairment and speech language impairment. Um, One thing to also kind of note with special education and disability categories is you could qualify for special education under orthopedic impairment. That does not mean that only the services you're going to be provided are under orthopedic impairment services. The category in which you identified for special education is more of like the door that gets you in the special education. The services that you provide are individualized to each child's presentation. I think that's important to note because the presentations of RYR1 are very vast. They look very different between all individuals. So this is really important to kind of note that no matter which category you're identified under, it should be the most accurate to your child's presentation. So if your child struggles most with the production of speech, then the speech language impairment would make sense to be the primary category. Versus if your child is more the motor function movement, orthopedic impairment would then be the most appropriate. But once they have either of those categories, they can get all of the services that make the most sense to support their education. So I know that was kind of a lot of information. So to kind of just sum it all together, the first part of that question, over 87% of participants who participated in this survey were, of parents or caregivers with an RYR1 related disease, do receive school-based services in school, whether it's accommodations or modifications. So if your child has an RYR1 related disease, they will benefit from school-based services. And they are identified under special education, under orthopedic impairment, other health impairment, speech language impairment.
Okay, thank you.
Yeah, absolutely.
Now, for children who do receive special services at school, what services do they receive?
Yeah. So this is the trajectory of these questions is kind of just making perfect sense for like my at least my brain and like how I'm thinking. So we know, these are the common, classroom difficulties that individuals with an RYR1 related disease, kind of experience. Do they receive services? Yes, they do receive services. It's under this category. So what types of services are they receiving? So like I said before, there's two types of services that we're talking about. We're talking about accommodations and then modifications. So the stuff that you see on the screen here is modifications. So these are things that you're typically going to see in an IEP. So this is like you've been assessed, you've been evaluated, you've been found eligible for special education services under one of the 13 disability categories. And now we're talking about individualized services to help your presentation. So for this research, the one limitation is we didn't look at very specific. So for example, like math services is fairly broad. The reason for that is this was the foundational study. So we really just wanted to look at what are individuals receiving. So it's relatively broad, but we just have more topic areas. So physical therapy, adaptive PE, speech language pathology services, and orientation mobility services. These are services basically to help the child get around the school easier. Those are the four most common ones. Again, very similar to the classroom difficulties, very similar to the different RYR1 presentations. Vast diversity. It looks very, very different. So we see a vastly diverse interventions in place as part of their IEPs and as part of their special education experience. This is totally normal. It's totally to be expected. It's actually how special education is supposed to work because it's supposed to be individualized. It's not supposed to be kind of cookie cutter and just kind of placed on each individual student, which is really good to see. But from a frequency standpoint, a lot of kids are receiving physical therapy. A lot of kids are receiving adaptive physical education. This is adapting the physical education curriculum so that your child can participate in it. I want to kind of pause on this one because this is a really important one that I find very important. I think gym is often overlooked in a lot of the schools that I've worked with. And if your child usually has an orthopedic impairment, it's usually quick for the schools to go, well, then we're just going to exempt them from gym and they don't have to participate in it. And I kind of urge you to advocate against that because children actually get a lot more out of gym than I think is like typically known. It's one, an opportunity for them to move and get around. They can learn obviously all the, healthy lifestyle things that they're gonna bring on for the rest of their life. We know that, but there's also a really huge social development component that happens in PE. This is where they learn teamwork. This is where they learn how to, work together with the team to be able to reach a goal. And this is also where they learn camaraderie, and they kind of just build a big social component in gym class. So adapting the curriculum so that they can participate is really huge. So simple example, just based on presentations. If you have a more severe presentation where your child might be in a wheelchair or has contractures and really struggles with moving, things like an obstacle course, or for a wheelchair only, primarily like tossing things and passing, things like that, as well as aiding the gym teacher in running the class. So moving the cones around and kind of just engaging in that sense. I've seen some where they've been coaches or refs. And then on the other side of the spectrum, with more mild presentations where it might just fatigue easily, can run up and down the gym once, and after that, you're kind of done. So things like structured breaks, it's pretty easy. You just work and you participate as much as you can, and then you take breaks when needed. That's a very, very common one, as well as being like all-time goalie. So you're just staying in the goalie. You're kind of structured in that one setting. And then another one that I quite like is being the teacher's like aide, so that they're still engaging, they're still able to support and get that development, that social development piece from participating in gym class without their disability hindering their ability to participate in that class. So there's two examples of how we're still talking about adaptive PE, but it looks vastly different based on your presentation. So that kind of goes down the line there. But just kind of pausing there because there's a lot of things on this information on this slide. But physical therapy, adapting the physical education uh, curriculum, speech language services, which is consistent with the IDA category, and then orienting around the school.
Thank you.
Yeah, absolutely.
Now, to continue with that question a little bit, do the parents tend to be satisfied or unsatisfied with those services?
hmm hmm So actually, let me pause there for a second and let me talk about some of the accommodations before we get into the satisfaction. So the accommodations, this is that second part. This is not part of formal special education in the IEP. This is more just the the little aids that are kind of added. Big thing to note with this is that it's primarily moving around the school environment, kind of like orienting themselves around um, the school. So extended time to move between classes. This is allowing them to be late to come to class, so they're not punished for that. Seating accommodations within the classroom, within the lunchroom, using the elevator, class proximity adjustments. This is basically if walking for really long periods of time very quickly between classes and they have to go from one end of the school to the other, you can adjust their class schedule. You can adjust the class proximity so that they're not walking either up and down the stairs or across the campus. And then using ramps or railings. One thing I kind of wanted to bring up here is all the way at the bottom, one of the least common ones is extended time for lunch. So this is something that is usually when I've worked with parents in the past with RYR1 related diseases, is lunch is a relatively difficult part to get services. And I think usually in schools, they don't have to accommodate or adapt lunch. And it's something that absolutely can happen. If it takes your child a longer time to swallow their food and eat their food, they should be allowed the adequate amount of time. That's a direct manifestation of their disability, and they should be allowed extended time to eat lunch. And that's just not a very common one. And I'm not saying that's because schools aren't providing it. It could be that this, presentations of RYR1 symptoms are not needed. Maybe they eat at a relatively frequently pace, and that's fine. But it's just something just to kind of note and kind of bring up. In the past, I've worked, lunch has been a relatively difficult spot to receive those services. Um, so overall, the main accommodations, modifications is supporting the ability to navigate around the school, speech services, physical therapy, and then participating in physical activity, really finding ways for them to participate. One other thing I wanted to note about some of the accommodations and services being provided in unison with the classroom difficulties is with this sample of parents, they reported that 30% of the children and adolescents with an RYR1 related disease experience anxiety and depression, with around over 20% experiencing social difficulties, yet only 6% are receiving psychological and counseling services. This is a trend that's fairly common in most public schools. I think we're trending in a positive direction where we're increasing those services. A lot of it is just a lack of resources on the school's end. But this is just something that is just, I wanted to bring up to note that it is still prominent in this population as well. So kind of going to your question about satisfaction. Again, if we look at kind of trajectory, we see these are the common classroom difficulties. We see, are they receiving services? Yes. What categories? It's under these three categories. These are the types of services. Well, now of those services being provided, I wanted to know, are parents satisfied with the quality of those services? So we know what types, but are they satisfied with the quality? And this was actually really good news because over 80% of parents reported that they are satisfied or very satisfied with the school-based services being provided. And that's in what's written in the IEP document, what's written in the special education document, what's actually being provided, and then the agreement between the two. So this is a really high satisfaction number. This is really good news. So the services that individuals with RYR1 that they need to kind of foster success in their educational environment, parents are very satisfied with the services that are being provided. So they're very easily able to be obtained, and they're satisfied with what the school is able to produce. That being said, there was 15 to 20% that report that they're not satisfied or not at all satisfied with those services. So something else that I kind of added, I wanted to basically kind of see of those who aren't satisfied, why might they not be satisfied? What's kind of the barriers? What are the difficulties kind of getting in the way? In my previous work with families from the RYR1 community, when we talk about schooling, it pretty much mirrors what was kind of found of those individuals that weren't satisfied. So of now, there was only 10. So the important thing to know is that most families are satisfied. This is only that small amount who aren't. But of those who weren't satisfied, these were kind of the 6 themes that came up for why they're not satisfied. And I really want to point to the top 2 because these were the most common. And in my opinion, I would say with just working in schools, this is probably going to be the biggest difficulty, even beyond just RYR1, but especially with special consideration to RYR1. So communication breakdown was the number one. This was where there was challenges in communicating your child's needs from the child, the parent, and the school, just being on different pages, the active communication piece. Specifically with schools lacking like knowledge of what the child needs. So something to note, and this is probably not going to be a shock for the parents here, but when you are a parent in communicating your child's needs to the school, you're kind of doing 2 things at once. So your RYR1 is a very rare disease, and it's likely that you are going to be the expert of your child's disease in any school-based meeting. So you're going to basically be doing psychoeducation on what RYR1 is, how it presents, and what it looks like in your child, while at the same time advocating for what your child needs. So you're kind of doing 2 things at once, which is a very difficult thing to do in a meeting, while kind of helping it be successful. That's a very difficult thing to do. So that's one difficulty that came up. Kind of very similar is advocacy. And this is a big piece that I've kind of, when I've worked with families in the past, this has come up in the past as well. And it's basically when you and the school disagree and trying to advocate for my child does need this. Something that came up before, and it even came up now, is especially with the mild presentations of RYR1. So when you have a very severe presentation of RYR1, whether you're in a wheelchair or it's something that people can see the disability, schools have an easier time providing services because you can see it. When you have a very mild presentation, proximal muscle weakness, just a mild weakness, and you get fatigued easy, schools can't see that. So what schools do see is the child saying, I'm tired. The child saying, I can't do this. The child taking a long time to eat lunch and showing up late for the next period. The child having a difficulty going up the stairs and shows up to class late. So the school is seeing this, and they can view that as like willful noncompliance. The child is lazy. The child is not doing what they're supposed to be doing on purpose. They know what they're supposed to be doing and they're not doing it. And they don't see it as that's how they see the behavior. They don't see the behavior as a manifestation of that child's disability. That's a really hard conversation to have with a school. And that's just kind of a barrier that kind of comes up. So overall, what this data kind of supports is that schools are doing a really good job. Parents are doing a really good job. The types of services that these children and adolescents benefit from in school are able to get them, and they're satisfied with those services. If you're going to run into any barriers, it's most likely going to be in that communication front. So preparing yourself with, how am I going to explain my child's needs? How am I going to explain RYR1? Being prepared that you're going to have to tell everybody what RYR1 is, pointing them to resources, preparing those conversations the best you can is going to be really, really good. Um, One other thing I'll kind of just put in a slight plug for: go to your school psychologist. They are going to be the number one person that is going to be able to understand how disabilities will impact their education. They're going to be able to have these conversations with you the best. They're trained to look through the research to understand. So if you tell them about, I have an RYR1-related disease, this is how it impacts me. Here's the RYR1 Foundation. Look at all their great work that they do. Look at all their resources. Then that school psychologist has the training to be able to look up on it, understand it, and then apply it to your specific child. So if you ever are at a loss of who to communicate with, or you're having difficulty, communicate with the school psychologist. That should be your point person. All right.
Okay, so the last question I have for you is, do children with an RYR1 related disease experience behavioral and emotional problems as reported by the parents or caregivers on the BES?
Yeah. So this is one of my favorite, I think, questions and like answers that kind of came from this study. So the BES, it stands for the Behavioral and Emotional Screening System. It's basically a 29 item screener that's used by schools or by just honestly mental health practitioners to basically screen for any behavioral, emotional, or adaptive skill difficulties in kids. Ideally, what it's used for, because it's very short, is you give it to the parent or the caregiver, they fill it out on their child, then we get it back, we can score it, it's normed, so we can compare your scores to all the other kids your child's age and see if your child is experiencing more risk in behaviors, more risk in internalizing behaviors, or more adaptive skills difficulties compared to other kids. And then, in theory, say they are, then we can follow up and then intervene and provide services. So I used it in this study basically to, all of the questions before were just descriptive statistics for this population. What is this population experiencing? This is unique in the sense that I can compare what this population is experiencing compared to the general population. So with this table, this screening system basically gets 4 scores. So it gives a overall behavioral and emotional risk, which accumulates all 29 questions into one. And it either is going to say, are you in the normal amount of risk? Are you at an elevated amount of risk? Or are you at extremely elevated amount of risk? And that basically means normal is your child is functioning just like everybody else. Elevated is your child is experiencing a little bit more difficulties than everybody else. Extremely elevated is your child is experiencing much more difficulties than other kids their age. So for this population, we had 38 individuals fill this out. And if you look at the kind of the cluster of bars all the way to the left, you can see the behavioral and emotional risk. Vast majority, 33 of the 38 of those children experience behavioral and emotional risk just like everybody else. Completely normal. So what this tells us is that just having an RYR1 related disease does not automatically mean that your child is going to experience any behavioral, emotional, or adaptive skills difficulties any more than we would expect any other kid to. More specifically, we can see the externalizing risk, which is that second cluster of columns. This is hyperactivity, impulsivity, aggression, defiance, things like that. Even more so, 36 of the 38 are in the normal range. So this kind of mimics that all the way back in the beginning, where we didn't really see a lot of aggression, we didn't see a lot of hyperactivity. We wouldn't expect that with this population. One of the most common presentations is fatigue. So we would not expect to see those kind of behaviors, and this kind of supports that. going to skip over internalizing, come back to that one, but adaptive skills risk. This is things like being flexible, being kind of adapting to different environments, working together with others to find or like to reach a common goal, communicating clearly, achieving like everyday tasks like self-care, things like that. Um, just similar to all the others, vast majority are right within the normal range. Something to note about this, kind of like zooming out a bit, of the research based on RYR1 related diseases, there's a vast majority of the research kind of supports that RYR1 in adulthood, individuals do experience adaptive skills difficulties. This is kind of the first evidence that shows in childhood they don't experience that. So it's likely that the support systems around them within the family, the community, and the school is enough to support their needs so that they can basically flourish adaptive skills wise and develop adaptive skills appropriately. So going back to internalizing risk, again, vast majority are experiencing normal amount of internalizing risk. This is anxiety, depression, and somatizations. Somatizations basically complaining about physical pains. Vast majority are within the normal range. We can see 13 have an elevated. So this is more anxiety, depression, somatization compared to other kids their age. So still the majority don't, but it's important to kind of mention this because out of all the others, you can see just visually, there are more elevated than not elevated in the, or more elevated in internalizing risk than there are elevated within the other categories. So it's kind of a lot of information to kind of throw around. But overall, just kind of reiterating this, 87% of individuals, of children and adolescents with an RYR1 related disease experience a normal amount of behavioral and emotional risk compared to other kids, which is great news. 95% experience a normal amount of risk of hyperactivity, impulsivity, aggression. 87% experience a normal amount of risk for adaptability, functionally communicating, completing everyday tasks. And 65% experience a normal amount of risk of anxiety, depression, and somatization, with 35% experiencing an elevated internalizing risk. So basically, just what we can conclude from this is just having an RYR1 related disease does not mean your child's at any elevated risk for behavioral and emotional or adaptive skill difficulties. But if they are going to develop some form of difficulty, we have evidence that shows it's more likely they're going to develop the internalizing risks versus externalizing or adaptive skills risks. Now, we don't know which specific, is it the anxiety, is it the depression, or is it the somatization, or is it all three? Because screeners are more so just to see, are you experiencing internalizing? If so, we're going to follow up on the specifics. So it's likely that the complaining about the physical pains could be driving all of this. It's likely it could also be anxiety. So we don't know that piece, but we do know that that's something just to keep an eye on. As your kid develops, it's important to look at some of those internalizing features of depression, anxiety, complaining about physical pains, and things like that, just kind of as that kind of develops. So yeah, I think that is all I have for these. Are there any other questions that we kind of want to address or kind of go through while we're here?
Yes, we did have a question from
Yeah.
someone attending right now. And so we already touched a little bit upon the PE accommodations. So
Mhm.
this is in reference to that. What are typical PE accommodations requested by people with
Mhm.
RYR1 related disease?
Yeah. So that's actually a really good question. So it's a tough one to answer in the sense that through this research specifically, we just looked again at that kind of broad, like, do you receive PE accommodations? The answer is yes. Specific accommodations is really going to depend on the individual presentation. So kind of like how I was hinting at before, like the individual presentations, they're going to look different. So how you adapt the curriculum is going to look very different. So kind of like I'll kind of like reiterate the examples that I said before. If your child's in a wheelchair, their PE participation could look like creating obstacle courses to help them develop how to navigate through the wheelchair, participate with the social groups, a lot of passing, and then a lot of coaching like with them. Versus just mild presentations, it might simply just be you're allowed to have a break. And if you need a 5 minute break just to go sit on the side and not participate, that's totally fine. Versus the other kids, you expect them to participate the entire duration of the class. So it's going to be very individualized, but those are some of like the common ones, like so structured breaks, chunking it, allowing them to, if they're doing the pacer test, so they can do the pacer test while just like walking around the gym, while still engaging. Or another one I like is if whether they're playing soccer or football or whatever, having them be a position in which it doesn't require a lot of like running or standing, things like that. So it's going to be very like individualized. So there's not. This is why like the next step of just do you receive adaptive PE, the specifics is kind of difficult to ask because it is so individualized, and that's really how it should be. It shouldn't be like these are the PE accommodations that we provide anyone that needs it, because it's going to look vastly different depending on the types of presentations. And RYR1 is so unique in the sense that it looks vastly different. You could have 10 individuals with the same RYR1 related disease, and their presentations look utterly different. So that might not be a most satisfying answer, but it's going to be very individualized. And the goal is whatever the child can do, build on that and allow them to engage with the peers. So not excluding them. Certainly not just saying you're exempt from gym, and certainly not just letting them walk around the gym class. Whatever the activity they're doing, there's ways to function so that they can do it. A lot of the ones that I've heard have been just like structured breaks and just being like, whenever you get tired and you need a break, take the break.
Thank you for that answer. And that is it for our questions. And
Okay.
I want to thank you so much for being able to join us and the RYR1 community. And thank you for your time. We really
Absolutely.
appreciate it.
Absolutely. I know we're gonna share this later at some point, and at the end of the slide, this is my email. So I've worked and I've consulted with many families in the past. If any questions come up later on, or anyone watches this at a later date wants to ask a question, please feel free to email me. I will definitely get back to you. I'm very passionate about this project and this work and this community. I think it's really important, and I just love working with you guys. I love working with the foundation. You guys just do such awesome work. So please feel free to reach out, and I would love to consult and kind of answer any questions that I can. So yeah,
Thank you. Well, again, Dr. Arman, thank you so much for joining us tonight. And to everyone who was able to join us, thank you. And I hope everyone has a great night.